where we talked about premature rupture of membrane, we talked about. Next is, very important, that goes in OB, preventing from infection, the mother. And assessment, always in OB, your priority is the fetal heart rate. The baby is first priority. Second thing is difficult behavior, therapeutic communication. How you talk to your patient is very important. Determine the reason for negative behavior. Now, whenever your patient is having, underline the word therapeutic communication, and you see your patient has a problem in behavior, do something about it. Behavior means is a mental problem. You communicate and make sure you do something about your patient. Because if you don't do something about your patient, and it may get worse, so do something about it. Your patient has been getting difficult for you to handle. Talk somebody, get some help before it gets out of hand. Hazardous material and spill, blood spill. Patient fell, patient bleeding all over, chemicals, vomitus, you got to clean properly. Bleach is always good to clean. Lead poisoning, we already talked about lead poisoning. And what does lead poisoning can lead to? What does it lead to? Lead poisoning, mental retardation, bones, teeth, blood, it affects on the blood, nervous system. And what is the word I told you when you're removing the lead poisoning? Chelation therapy. Write down the word chelation where you're removing poison. Any kind of too much of poisoning by chelation therapy. And remember the medication, write down BAL, BAL, and EDTA. We have done that. So make sure you remember chelation therapy, remember BAL and EDTA. Lead is found in old furniture. Lead is found in old houses, the glasses, playground. Are we clear? And lead poisoning, children should be screened for lead poisoning because of the toys, the furniture, and they can get, and it's not good. So everyone, you must know lead poisoning question. We are reviewing back again. You go and take a test and you don't know where is lead poisoning can affect. Safety car seat, we did already. Newborn babies, you put them in the back of car seat and do not put them in the front seat. And also recognize environmental poisoning for the children. Who is more dangerous to get poisoning is your toddler. Then I want you to lupus. What is lupus is? Underline immune system. What isolation do you put lupus? Reverse isolation, same as rheumatoid arthritis and lupus erythematosus. And lupus is affecting where? Because it's a inflammatory disease. And when they're saying inflammatory lupus, systemic lupus means it's a systemic disease. I want you to write down when they use the word discoid. Discoid lupus is not inflammatory. Discoid is only on the skin. Are we clear? So they have, what kind of rashes they have? Butterfly rashes, right? Are we clear? What do you prevent your patient in lupus? Don't let them go out in sun. Write down the word stress, avoid stress. What isolation are you going to put them? Reverse isolation. And it's an inflammatory disease, autoimmune disease, attacked by own immune system. So lupus, I want you to write down reverse isolation. Write down the word discoid means non-inflammatory. When they're saying systemic lupus, that is inflammatory disease. Discoid means only the rashes on the skin. Prevent them going out in sun. Prevent them from stress. How do you treat them? By steroids. Steroids. They will need steroids. And where does it affect? Immune. Even you don't know If you know something heart, cardiac, effusion, if they say, lungs, it affects the kidneys. Write down, lupus is not only on the skin, systemic means it's affecting on all over the body, your cardiac, and they might say pericardial effusion, lungs, they have problem in breathing, and the kidneys, and their renal failure, they can go. So even you know something, you can't just go in the exam, you don't know what lupus, where are you going to put isolation, what is lead poisoning, and the exam. Auto question we said, risk accident, car accident, very important young males, early driving, not careful, accident. Room assignment, we already talked about, dirty versus clean. Always dirty versus clean. Clean is clean. You got to wash hand and keep the area clean. Removing personal protective equipment. You must know how to remove gown, how to remove gloves, how to remove the goggles and the mask. When you're opening the mask, open the string from the back. Be clear. When you're removing the gloves, first you remove it, fold it, then inside you go second one. Gown, open it, inside, out. You will do that. Pack it inside. And standard airborne droplet. So you're going for exam, you don't know how to remove gown and gloves. You're not going to pass. So it's better you know and read about it. And also precautions, droplet, standard, airborne precautions. And underline the word on the other side of the page. Herpes zoster, even they say is localized, you still put it airborne. Are we clear? Even they're saying localized, but is coming from airborne. Droplet, you guys have all underneath, and I gave you the package. So I want definitely the package I gave you, you memorize, because it covers everything in that package. And next is looking for your patient complication, procedure you should know, and little difference finding most unstable patient. Always you go for that. For any question you ask, priority for your patient. What is your priority? What do you do first thing for your patient? Unstable patient are, you're looking for more is your diagnosis and your symptom, chronic versus this, we already talked about, ABC we talked about. Last two line, very important. We all know private room, all that. And what is the last two line? I ask you, at-risk patient, low white blood count. Are medication, chemotherapy, reduce that. Immune system disease and cause lower resistance, risk for infection. Don't put them with patient with infection. So your chemotherapy patient, your white blood count is low. Are we clear? Neutropenia word, write down the word. And so do not put them. And they are risk for infection. Steroids, when you're taking a steroids, you risk for infection. So those are common wording, we already talked about it. Now I will move on to the next page. Chest pain, anginal pain is bad. And all your patient with pain, very important, second line, they use the word pulmonary toilet. Treatment is for patient or for lungs. Pulmonary toilet means deep breathing exercise, meaning mucomist. Breathing exercise, incentive spirometer, thickening of the secretion, you loosen up the secretion. Are we clear? Now what do we remember here is what do you give before you give broncho CPT? So remember, chest physiotherapy, CPT, and before CPT, give them bronchodilator. So remember, they may use the word toilet word, and they are using the word treatment pulmonary toilet. Pulmonary toilet means all that what you do for treatment of lungs. ABG, we all should know ABG. We already talked about. Bronchoscopy. What is bronchoscopy after? Yeah, they're going into the lungs through the mouth. Write down. After bronchoscopy, gag reflex. To monitor, don't give any water unless they have they clear their lungs, their gag reflex. Complication, pneumothorax or bronchospasm. Spasm means the difficulty in breathing. And pneumothorax means collapse of the lungs. So what are the complications of bronchoscopy? Maybe your pneumothorax and bronchospasm, and remember the word gag reflex. That goes in your respiratory. Allergies, very important. Iodine, all your patient who's going for gram word, cardiac catheterization. What do you check? Allergy, underline the word shellfish, is allergies. And also angiography, MRI, same patients are. Do not, if the content dye is used is iodine. And so check for shellfish, also allergies. So remember, allergies are. And don't let your patient go when they have metal in their MRI. For MRI, no metal. And for image. So a lot of questions are, patient is going for this test, what do you monitor? Allergies. And what do you monitor? What do you do afterwards when they come back? Encourage fluids and check for allergies. Write down, after the procedure, you give them fluids. So increase fluids. Nursing consideration for test and procedure, expected outcome for your patient before test and after. So remember, a lot of your tests, what are the tests I told you? You should know. Cardiac cath we did, lumbar puncture, everyone should know. Paracentesis, thoracentesis, we have talked about, you should know. And patient is going for that. Cystoscopy, paracentesis, thoracentesis, cystoscopy, liver biopsy, you should know. So remember, these are the procedure and they can get you in the exam. What is the is paracentesis? What is paracentesis? What is paracentesis means? They are removing fluid from where? From peritoneum cavity. Are we clear? Thoracentesis, they're removing from the lungs, right? What is the outcome of your patient when you remove fluid? What is the outcome from thoracentesis and paracentesis? They can go into what? Shock. Why? Because you're removing the fluid. Are we clear? So what do you monitor? Monitor for bleeding, monitor for shock. So we got to know liver biopsy. What is the risk after liver biopsy? Bleeding. What side are you going to turn your patient after liver biopsy? On the right side, because the liver is on the right side. Apply the pressure. Everyone, your procedures are important. MRI is important. Your patient is going angiogram, all that, allergies with shellfish you monitor. Know the nursing consideration and test before and after. What do you tell before lumbar puncture? What do you tell before lumbar puncture? Empty the bladder. What do you tell patient before paracentesis? Empty the bladder. Are we clear? When you're going in the stomach, what happened? They can puncture the bladder. What do you teach patient before thoracentesis? What do you tell the patient? Where are you going? In the lungs. So what do you tell the patient? Don't move, don't cough. Why? You can puncture the lung. So read your question good. Make sure you're going to have question, what do you tell the patient before the test and what do you do after the test? Are we clear? So all those complications are important. Now, is INO. You must know in 1 ounce is equal to 30 cc. Intake. When you're writing, you don't write in ounces. You got to convert in cc and total it up. Are we clear? And 1 cup is equal to 8 ounces. So what is 8 ounces are how many cc?
40.
To 40 cc. 30 ounce in 1 ounce. But if you have 8 ounce, then you multiply 30 with 8 ounce. Are we clear? So your total fluid will be how many cc? 240 cc. So remember, 1 ounce is 30 ml. So if they give you a cup and you don't know how much is in a cup, remember 8 ounce, or remember your cup is equal to 240 because you have to multiply with 30. Are we clear? So everyone should know how much is in a cup? 240. All your liquid you got to measure in cc and total up your INO. And they might give you, this is your patient drank 1 cup of coffee, 1 cup of this, and 1 cup of this, so, and 8 ounces of this, 3 ounces of this. So what is your total? You got to come up with your total. Are we clear? So we got to know your total. And remember, ice chips is also a fluid. So you got to count your ice chip. Intake. You got to know correct INO. Look at the frame 2 hours post-op, different need, potential complication. Then 2 days. 2 days patient is more stable. And 2 hours patient come back, you got to monitor bleeding, breathing, all that. Unstable patient as seen by LVN. Unstable RN versus LVN. RN should be good. Timeline question is important in recovery. Back on the floor. Did they start chemo, and for how long is your patient is? So timeline. Is the time dose of medication? Look on their medication. Oh, colostomy, new colostomy and old colostomy is important. And what is in older people? Underline the word older people. What do you remember in medication for older people? What is in older people question with medication? What happened in older people are, remember one word, avoid polypharmacy. Write down the word polypharmacy. What is the meaning polypharmacy? Too much of medication. Why? They are not absorbing your medication. So what is, remember, when we are getting older, everything is going down. Your lungs, your skin elasticity, and your GI system, what happened in GI system, reducing absorption. What do you monitor? Don't give bigger dose. You got to cut down the doses. You don't give too many. They're taking 20 pills. They may not need those 20 pills. So what do you avoid? The doctors, the pharmacists, the nurses, we need to review the medication, and they will say, what do you cut down in older people? Don't give too much of medication. Why? Reduction in absorption rate. Are we clear? What are the older people at risk for? Older patient questions a lot. What is another thing in older patients are? Their skin. And what happened to the skin? Write down the word fragile. And also lose elasticity. And are there risk for rashes? Are there risk for skin breakdown? And what is the skin is like a paper. So what are they losing? Elasticity of the skin. Breathing problem. Bones. Older female. Why they are having bones problem? Write down the word estrogen is low. That's why they have osteoporosis. So remember in your question, polypharmacy, osteoporosis question, skin. And remember, they are getting shorter. And what do they have? Kyphosis. They're bending the backward. And the lungs are not expanding. They're risk for pneumonia. So older people questions are going to be, everything is reducing. Very important. Your patient comes with 20 pills. They're taking home. They're taking 10 vitamins, 10 pain pill medication. They may not need those because they're not. So what happens when they don't absorb? The medication stays in their body and they can cause confusion, more confusion. So we review the medication, avoid polypharmacy. Older people assessment, very important for that. What are the older people at risk for? Remember in your question, fall, confusion, because they're getting confusion. Don't restrain them. Reorientation. In simple answer, but don't pick up the answer. It may look good, but may not be good for exam. Okay? Next is, in older patients we did, and at the time question is very important, recovery, we did that second week. Nclex, best perfect answer, is you want to see listed below. Evaluate your answer carefully. Anything that causes fluid shifting, keep moving in the bottom and it says fluid shifting. What is fluid shifting? Write down the word hypovolemia. Fluid is shifting in the body. Hypovolemia, and they're going into shock. And which patient do you see that? Blood pressure would be low, and IV patients are, diuretics patients are, paracentesis patients are, thoracentesis patients are, NG tube rapid drainage and diarrhea. Check the blood pressure first. Are we clear? So which patient is fluid shifting? We are talking about burn patient. Monitor for shock. Are we clear? Thoracentesis, underline, paracentesis. You are giving diuretics. What do you check for your patient? Blood pressure. Are we clear? And what is another thing you check for electrolytes? Potassium. Why? They lose a lot of potassium, your diuretics. Chest tube, we already talked about. See, I'm reviewing over and over, and you got to get good in those areas. Chest tube. Question. What is important in the water seal bottle? Anybody remember water seal bottle? What is normal? Fluctuation is normal. When the fluctuations stop, the meaning your lungs have been re-expanded. But before you remove the tube, do the chest x-ray to be sure. Documentation we did already. Don't write everything is good. Everything is normal. What is normal? Got to write vital sign normal, right? Patient stable with weight. Patient appetite is good, eating 80% to 90%, right? That's the meaning measurable. You got to measure, you got to write it down, objective. NG tube, G tube, everyone should know. Giving medication through G tube, NG tube, and starting residual. What is a normal residual? When you can feed less than 100. Are we clear? If it is 100 or more than 100, no feeding. Hold it. Everyone should know placement of tube. How do you check tube feeding? What is another word for G tube? What is another word they use for G tube? Write down the word percutaneous. Percutaneous gastrostomy tube. It's same. Percutaneous means they have done surgery. Are we clear? So how do they put G tube? They have to open here and put it. So they use the word percutaneous gastrostomy. What is gastrostomy? It's not going through the tube. It's going directly in the stomach. Gastrostomy tube. What is important for your G tube patients? Skin infection. Are we clear? So what happened here? G tube, it's a surgery. What do you monitor for G tube? Infection. Some doctors want clean every day and cover it. Now a lot of doctors wants to leave it open, let it dry. But what happens sometimes they start leaking the formula and it lead to very bad infection and it can lead to peritonitis. Are we clear? So what do you monitor for G tube patients are? Infection. And check the infection site. NG tube. When you are putting NG tube, position. Fowlers. And what do you do when you are inserting in nose? Go backward, hyperextended. When it comes in oropharyngeal, then you go flexion. What is the pH of the stomach? Less than 4. More than 4 is not in the stomach. How do you confirm G tube? Percutaneous G tube. Surgery and X-ray. For confirmed X-ray. Everyone, don't get surprised. You are coming in, putting in order how to put NG tube, how to remove NG tube, and also G tube care patients are checking your patient, your residual. Dressing change is important. Those are your questions. Are we clear? So you got to know. Greatest number, the greatest good for the greatest number of people The more people you have, more people involved in your care. Healthcare providers should not become a second client through exposure to the first client. Don't want the infection from one to another. You got to prevent. Need to determine in the situation for threatening and caregiving those who are in ER, ER area. It's important to prevent spread of contamination. All your questions are hand washing and your isolation. Hazards, we already talked about. I want to skip that, contamination. Go in Lyme disease. I did already Lyme disease in previous. So when I'm repeating here, make sure you go back in the first pages. And it is in the stages. In the first packet, there are 3 stages: first stage, second stage, and third stage. And Lyme disease comes from ticks, and prevent them from tick bite, right? And how do you remove the tick? By using tweezer and throw them in the toilet or close them in the jar and take it to the hospital. When do you know Lyme disease in third stage? When they have severe arthritis. So write down on the side arthritis. When they have cardiac problem, they have neurological problem. And how do you treat Lyme disease? By giving antibiotic, and common in Connecticut in ages. C. diff is very important. C. diff is contagious. What is C. diff? Write down enteric precaution. What is enteric? Contact precaution, hand washing, gloves and gown is important. So write down C. diff, okay? And a lot of it comes from antibiotic, longer antibiotic, a lot of time in older people, second line. And effect of anything taking before C. diff, stool specimen. It's a diarrhea. So you will see C. diff in a stool. It's a enteric precaution. Then contamination and risk for patient who is contaminating for everyone. So everyone on this page, you guys need to know your Lyme disease, C. diff, very important. And I told you is all your prep for your patient, chest tube, we already talked about it. Next page, I'm going to move on to the next page. We did that, 9 and 10. Now I will move on the next. Health promotion and maintenance. So you are preventing. Not only you are preventing, promoting, and underline the word maintenance. You got to not only treat your patients, send them home, but maintain them. Erikson theory, we already showed you. You must know. Play, all kinds of play, parallel play, ego, patient, child are, and also cooperative play. Those are play in childhood, we already did. And amniocentesis. When do we do amniocentesis? And why do you do amniocentesis? What do you do why do you do amniocentesis? Why? Come on. What is important thing you got to know? You can look the genes and the problem and defect, but very important, lung maturity. Write down the word lung maturity. And before 16 weeks, full bladder. Anything before 16 weeks. After 16 to 20 weeks, any question? 16 to 20 weeks, if they give you before, full bladder. Mother has to be full bladder. After this will be empty bladder. That's number 1 in your question. Why do you do? You're looking LS ratio. What is LS ratio? I told you normal 1 into 2. And that is called lecithin. Lecithin, sphygmomyelin. That's a test. And they're looking for lung maturity. So everyone should know amniocentesis shows you the baby's lungs. Are we clear? So baby's lungs are not mature. They can do it after 20 weeks also. But a lot of them in your teaching when they're saying is for this, full bladder, empty bladder. But remember, 36 weeks, 38 weeks, a lot of time the lungs are not mature. And they're going to say, what test are you looking? Lecithin ratio. Are we clear? So why do? You are looking the maybe a sex and the genetic problem, but very important for lung maturity. Are we clear? After amniocentesis, what do? Monitor mother for fetal heart rate for the baby, and also mother can go in early labor. She can go in early labor. So check the contractions if mother start any contractions. So what are the complications? Number 3, bleeding. So everyone should know, is rupture of membrane is different. Amniocentesis is the test in the OB question. Now if you go and you don't remember all of them, the wording will not be good. Okay? So play, we said already, amniocentesis. Then RH incompatibility is RH incompatibility. What do you give? Rogam, right? Rogam to the mother after the baby is born for RH incompatibility. Mother is RH negative and baby is RH positive, then you give them Rogam. If they give you vena cava syndrome, what is vena cava syndrome? Write down the word hypotension. Mother blood pressure is dropping. And meaning is, what do? Put the mother on the back or turn her on the left side. Baby compressing vena cava. Underline the word. Why you're turning the mother on the left side? To release the pressure on the vena cava. And so that's important. Now we talked about, remember the word wheel chop, variable cord compression. What do? Cord compression means prolapse cord. V means variable. What is the variable? Means R, cord compression. And what do for early is coming normal. What you all know, what do when you have cord compression? Turn the mother on the knee chest position or low Trendelenburg position. Are you going to cover the cord with normal saline? Yes. Are you going to give oxygen to the mother? Yes. Are you going to prepare the mother for C-section? Yes. Are we clear? Prolapse cord. Prolapse cord lead to what? Variable deceleration. Are we okay? Early deceleration comes from head compression is normal. You don't have to do anything. A means is okay. Only the bad one you have variable and late deceleration. Placental insufficiency. What is placental insufficiency? Means bleeding. Write down abruptio placenta. What do when mother is bleeding? Turn the mother on the, what do when mother is bleeding? Left side. And stop the Pitocin. Prepare the mother for delivery, C-section. Babies need to feed frequently. Underline the word hydration. Increase intake without increasing frequency of feeding will not help baby rehydrate. Underline the word for hydration. Check voiding. Is amount of voiding and stool. Tells you hydration. Child mother says baby has been having diarrhea. What do you ask the mother? How many times did you change the diaper? Why? Because it tells you if baby is peeing, it means they are hydrated, but they're losing. If they're not changing diaper, that means they're dehydrated. Is, underline the word, normally 2 to 3 bm daily, 8 wet diaper daily. Okay? Now you do have on the other side something else. Difficulty in sleeping may be tested for another symptom. And physical, if so, it's a physical issue. However, in some case, is checked for, answer would be looking for your the reason and particular situation, physical problem, and maybe child is not. So don't go a sleeping pill. Any patient who's not sleeping, what do you provide? Comfort measures. Write down there, comfort measures. And diverting their mind. Back rub. Relaxation technique. So sleeping doesn't mean they need a sleeping pill. Sleeping can be a problem. How? By discomfort. So provide them comfort. Normal newborn babies assessment we all should know. We have done in the first pages, and normal growth and development, their weight, their height, anterior, posterior fontanelles, you all should know. Risk hyperbilirubinemia can lead to need phototherapy. Complication is encephalopathy. And next is risk factor. You are looking for all your diseases. Postpartum hemorrhage, very important in OB question. What is a normal blood loss would be in the mother when she is bleeding? What is a normal blood loss? Postpartum hemorrhage will consider when? When mother is bleeding more than 500 ml of blood. And then we have something with the diaper. I will go on that side. So write down 500 ml. Consider postpartum hemorrhage. If mother is bleeding, what is one thing you will monitor first? What is one of the reasons mother start bleeding? Yeah, she will go in shock. But what is one of the reasons for bleeding could be the retained placenta. Write down the word retained placenta. Placenta retained. That means contractions are not there. And some reason of contraction, what do you tell the mother? Empty the bladder, first thing. Massage. Second thing, you can do the massage. Empty the bladder. And third thing, the medication. What medication do you give them? Methadone. It's for contraction, but after the baby delivered and placenta, you use methadone. Are we clear? So contractions could be one of the reasons, but monitor mother for postpartum hemorrhage, and she's going into shock. So that could be one of the things you will need to know. Pathophysiology behind hypoglycemia. What is hypoglycemia can cause? What is a reason with pathophysiology? Is understand pathophysiology behind newborn baby. Diabetic babies are hypoglycemic. So write down diabetic babies are from diabetic mother. And what do they have sign and symptom? Jitteriness. Write down the word jitteriness, shaking. And they also have low calcium, low sugar and low calcium. Write down the word jitteriness. And also they have respiratory distress, pathophysiology, congenital defect they can have. So what are you assessing hypoglycemic babies are? For hypoglycemia, respiratory distress you're monitoring, and you're also monitoring for jitteriness. And big babies, they can be a bigger babies also. We did in the other chapter, mother is addicted mom. Babies are crying and not responding with their sign and symptom. Low temperature, cardinal sign of newborn babies can lead to cold babies, will be emergency. Breathing problem, cardinal sign is low temperature. That's why you keep the babies warm. They can go in right down respiratory distress. Minimum handling to the newborn babies. Don't handle them. They lose temperature. Symptom, you think entire group of symptom and think a big picture about your patient. Eliminate answer. Only one address, one symptom at a time. Now you can read that. Saturated pad, 100 cc of blood, a 1 saturated pad per hour is considered hemorrhage. So always check the number of pads. Per hour, 1 pad would be a lot. And tell the mother to empty the bladder and not to expect it, assess for drainage tubing. How the childhood disease, incubation period, exposure, precaution. Write down the word childhood diseases, you prevent immunization. That's why your immunization, all diseases, you got to give them. and also the heart sounds and where the valves are located in cardiac. Now, we have done a lot of things, there's a lot of repeating, but remember, whatever repetition is coming, you got to memorize. I think we'll stop here, and tomorrow I'll finish this, and there's another package, and there's a lot of repeating, so, and there's a lot of some drugs coming back again, and so I will end up, maybe by tomorrow we should finish. Okay.